I'm David Hammer, a senior executive with Accenture's Healthcare Revenue Cycle practice, and I'm based in Accenture's Miami office. Accenture is an international management consulting, technology, and outsourcing company with over 244,000 employees in 120 countries across the globe. We have extensive capabilities, vast experience, and we do a lot of research on the world's most successful companies so that we can deliver high-quality results to our employees. We have a very robust practice in both the provider and payer space, both in the United States and internationally, in which we work with the largest health systems and academic medical centers, as well as the most important payers, to improve operations and deliver higher quality client service and outstanding business results. In today's business environment, there are so many business challenges that are facing both the provider and payer communities. Predominant among them is the issue of healthcare reform, or the Affordable Care Act, which was passed early in the Obama administration and which is up for review in this session of the Supreme Court sometime in mid-2012. There is a great deal of uncertainty in both provider and payer business models over this, and we're unsure whether or not the Supreme Court will rule the entire law constitutional, or rule the entire law unconstitutional, or just the individual mandate part of it. But notwithstanding how the Supreme Court may rule on the issue of the Affordable Care Act and the individual mandate, almost all of the reimbursement changes that are in the law are completely within the purview of the Centers for Medicare and Medicaid Services under its existing statutory and regulatory authority. And so there will be significant changes that will happen in the way hospitals are paid and the way that payers, who always follow Medicare's lead, will be paying hospitals in the future. And in particular, Medicare is urgently trying to shift from a unit-based reimbursement model towards an outcomes and quality-based reimbursement model. And so assuredly, the environment for payment and reimbursement is going to change. Then, of course, there's the issue of the sustainable growth rate, the reimbursement rate for physicians, which is due to be cut by over 1/3, and Congress has been punting this issue, and most recently, just before the holidays in 2011, there was an extension of only 2 months in this, and so a day of reckoning is going to come with the SGR issue. Then, of course, there are all the issues that face providers on the cost side. With the changes in reimbursement, providers must get a better control over cost. Then there are workforce issues and capital access issues that have been facing this community for a significant time. Accenture and Pegasystems partner really well in helping clients solve business problems. Healthcare revenue cycle in particular is highly labor intensive and complex, and all too often is shackled by the "we have always done it this way" approach. And in doing so, we are able to analyze business processes, take out redundant steps, coalesce data from multiple disparate systems, and put in decision rules that help organizations achieve demonstrably better results. They can either do the same work with fewer FTEs, or using the same number of FTEs achieve even better results. Well, when we're working with Pegasystems, we define metrics usually by the percentage of net revenue, and we've seen clients that have increased net revenue by from 1/4% of net revenue up to fully 1% of net revenue. Now, that may sound like a small number, but when clients are measuring their profit margins, sometimes in the 1 to 3% range, an improvement in the best case scenario of 1% of net revenue can mean an increase in profit of literally millions and millions of dollars in some of these organizations that have hundreds of millions to billions of dollars in net patient service revenue. Another key area is the process of care delivery. The revenue cycle and its associated efficiencies, or inefficiencies as the case may be, is directly affected by the processes of care delivery. Accenture and Pega can work together to improve clinical care delivery by helping improve documentation, reduce loss charges, and improve charge capture overall, and this in turn can lead directly to improved revenue cycle outcomes. Pegasystems' technology and people are both absolutely first class. That's something I've learned since coming to Accenture. The software itself has tremendous flexibility. It's easy to use, easy to deploy, and achieves positive ROI extremely rapidly when customers have a strong commitment to its full deployment and rollout. For both companies, our reputations are extremely important to us, and we believe that our collaboration only burnishes those reputations through the mutual achievement of high-quality client results. It's a pleasure to partner with Pegasystems.